Good morning, everybody. It is October 8th. Premier Savikata is in Iqaluit in his constituency for the long weekend, so Minister Hickes will start us off with an update. Dr. Patterson will provide some information about the situation at Hope Bay Mine and where we are on Nunavut's path, and then we will get into questions about Nunavut's continued COVID-19 response. Thank you.
Ula sa kulumi October 8, sibulat di sabi kata vani matabani kata gunda jangi pinaso ako si unong ngani tavani nangat. Minister Hickes o kalimalang luni luta Patterson o kalimalang ambiyo tay ko uyakan na bi me Hope me kan ito kalang mga maluno na bumatiyak pala ni nganut nubatjuang na mitsano.
Good luck. Good morning. The total number of persons followed to date is 3,159. And there are 523 persons currently being followed. Dr. Patterson will speak in just a moment about the situation at Hope Bay Mine. But first, I want to thank everyone who has worked so hard over the last few weeks to make sure this outbreak was contained, traced, and isolated. This work is invaluable in better understanding COVID-19, how it is transmitted, and how we can keep people safe, not just in Nunavut, but in other jurisdictions as well. Thank you to the Rapid Response Team, the Office of the Public Health Officer, and everyone involved in the logistics over the past few weeks and months preparing for a situation like this. We appreciate all the hard work to keep Nunavut safe and well. Finally, as we head into the Thanksgiving weekend, I remind everyone to stay aware and attentive in keeping food prep areas clean, frequent hand washing, keeping gatherings small and within the current limits, and to stay home if you feel sick. Thanksgiving may not be the same this year, but we still have a lot to be thankful for. As we continue to practice our public health measures and keep one another and our communities safe, please remember, your actions, everyone's health. Thank you.
Ulakut, takwa katilimatugi, kawisak daw si mayo ulumimot 3,159, takwa 523, suliw takiyaw yung kawisak daw gutingit. Luta Patterson, ho sa kalangayok ta kanoy palya mga ta Hope Bay o yakam na abingan ni. Sebula pa may ko yan na may rumayak katay ko at sa ruta hak sa mayo pinaso ako sigalaw sa mayo ni. Tahan na siyang mapalya ni nga siyang magkan na hunago. Ang malo kati si mayo yung hawi ya hulugit ang malo inutu gunak tita hulugit. Taman na pilira ngo yung atu tihat siyak tutukisi yung mayo siya kan na hulugon uvadyo anak 19. Kano siyang masung mga kanok luuluran at tumitay itit sigun ng mga ata. Nung nagumbitong ito ka na tawasingin nila, vitor si mabiyo yun eh. Huyan namin tabutay ko, ito agang naktukoy kayo reaktiyo lauktot. Amalo, anaham nang ituliriyo, ang labi nga. Kikulimalo, ikayo kataw lauktot. Pinasa ako si mayon eh, takikalaw si mayon eh. Upalong ayak sa titay may itumon. Huyali bugot at surutrak si maningit. Nung nagumiwat ka na tumitay likulugya, kano'y tay likulugilo. Kinula pa mi, kuyalin na pinasa ako si unong ano tikilik tiluta. Kahit si bunga udyasot sa akulusi, kayasat sa akulusi. Nakilir biwat takwa salumay na titaw hulugit. Agka silawasay na katarlugit. Katikatak tulwa may sulo katakunagit. Takwa isulit tabiyo yung malitaw lutik. Ang ikasi makatarlo silo kano'y tsurito akot si. Taman na kuyalin na adyo dyan ito galaw taban ipinaso ako sa me kisiya ni suli kuyalin jutit sa kaktugo ami suni takwa ato ti kaktilu ta suli anahan nang itulari ng mamalitaw gayalinik takwa at tanak tumitay ilit katigi pugot ikaw malusilo kano ili ako tigiyasi kikulimano ato'y nakakon ng ngata.
Good morning. I'll begin with an update on the COVID-19 outbreak at Hope Bay Mine. To date, we have confirmed 10 positive cases of COVID-19 at the mine with 6 presumptive positive cases awaiting confirmatory testing. Since arriving at the mine site on September 29th, the Rapid Response Team has been working hard to complete the test, trace, and isolate protocols required to break transmission of the virus at the mine site.
Ula sakut pigay ako taka kumayang ulo may makanilok to kasi mga ano pa 19 sa mapalya si maningani Hope Bay o yakak na bingani. Ulo may hulit nalo na ito si mayo no pa anak to kakningani o yakak na bimi. 6 suli pasagayaw yu utak yaw yu nalo na ito kaso ato kaya saktaw gutingin. Tikilaw nga tanik September 29 mi takwa tuwagan naktukoy kayo reaktit at suruto kasi mayut kawi sa katak tutik tikun ni katisin ng mga ta kawi sa palya sutik amalo inututit sinang mo atwaga ni malitaw kay lutik taman na siya mapalyakan na kunagoyak na abim mi.
Best practices around the world show that testing, tracing, and isolating, combined with other measures such as travel restrictions and mandatory mask protocols, are effective in stopping further acquisition and containing outbreaks of COVID-19. Restricting travel for the past 10 days was instrumental in containing the outbreak and in reducing the risk of transmitting COVID-19 to other jurisdictions. The risk to Nunavut has remained low throughout this outbreak.
Takwa pilarit siya zutiu si mahatak dun pilarit siya si magutiu yununak juami sakir tau si mamata hawi sa katamnek amalo kikune katisin ng mangata amalo inututit sinak katitaw si maluti asingin ni malitaw galing ni surlo awlak titsit taili ng mo tikititsit taili ng mo amalo asego behang ito kumatuak si mahatarahang ng mo takwa tu tihat siak tu takwa nga siak maktawgon ng ninganik tamakwa nuwa juam takwa lo tikibiw taili titawlaw tilugo ulo ni hulinik tana siak matayli titaw si mayok amalo taman na nuwa juam nak 19 asingin no abitok si mabiyo yun na siak maktayli titawgon nak si mayok ulo kaya nato si maninga no navumiyo no taman na pasit si mayok tarina siak makpalyabiyo tilugo yakang napimi.
Today, based on the team's work, I can report that there is no further evidence of transmission on site, and while the risk can never be zero, we do consider the outbreak at Hope Bay Mine contained. This means that travel to and from the mine can resume. Individuals who have finished their isolation period and individuals who were not identified as high-risk contacts can travel home. Some high-risk contacts remain in isolation and are expected to be cleared to travel within the week. The rapid response team will be leaving the mine this afternoon and isolate for the next 14 days.
Ulumi, tayo pilirigatos si mayo malitug kano ilo tigis si mayangit o karom naktunga tayo magsakit si mayo hangin mat siya makpalyaning ani taman na uyaram na abimi. Tan na ulo kaya na Guni jang itu galo akisya ni takan na siya mapalyaning Hope Bay uyaram na abingani nukak titaw si malakto. Taman na tukilik tikibiw hatarom nakto aw labiw hatarom nak siluni uyaram na abimi. Kikutuin na itako piyakir si mayo inutukay na kaya hak titaw si maninginik. Takwa lo nalun na itaw si laung itulo kaya nak tumininginik. Ang ikaroon nak si Diyo. Tako ilang ulo kaya nak tumilaw to suli inutu titaw kaya hatut ambalo nariw kaya yun awla kong nalalag ningin ni pinasa ako si ulak tumi. Takwa to abang nak to kayo kaya ti ulak to ulumi unno sa awla lang ayun. Takwa lo ulo ni 14 ni anit tayo kayo na kaya kalagluti.
This week, we also moved forward along Nunavut's path and further eased public health measures in territory. Among the changes were increased gathering limits and allowances for expanded recreation activities. We now have testing available in both Rankin Inlet and Iqaluit with a system in place to reduce the time it takes to receive test results. Our pilot project to reduce turnaround times for testing has been successful and has been integrated into our operations in the Baffin region. As of October 14th, we are extending this project in the Kivalliq and Kitikmeot regions. As always, we will continue to monitor and assess the situation. If the risk increases, we may tighten measures to ensure the health and safety of all Nunavut.
Kabani pinasa ako sa misi bumugi ako takalaw migata Nunavut matuya palyaning inu takwalo kasuyaw valak tutihan na hamang itulari na mamalit taw kaktitaw galit. Takwa ilang yasid siya taw laktut amisok mo kaya taw lutik katikati gum naktut amalo takwa kipingoy ako tayo gum naktut pingoy ako tayo gum naktut lut piyon naktitaw laktutik. Takwa kaya sa taw gum naktut matatamakin kanya sinagme ikalon nilo. Takwa lo hilamiw naksakko kaya sa kutiyo yo tikataron naksilluti. Tena utuk ako tiyo lauktok Hilami unasak ko kayo sa kutiyo ti katahulugi kayo sitsar na kakasumamat at ulit titaw si mayok awla tayo yun nakikitalom me. Amalo October 14 ulit kataman na piliyak utukaw tiyo atuk taw lila mayok kibalang me kitir me unilaw. Tayo mga lima tako kayo sak palyangin ng naktabukan yung palyago tiyo yun. Ulo kaya naksibalik halo tamak ko kasuyaw valyayo ti ma isulit tabiyo titaw yun at titaw tuyo na kaya li tamak ko kano itay likho na ulo kaya naktamay itay likho lugilo nunavut me ulima.
I will end on a happy note and let Nunavut's young and young at heart know that Halloween is a go for Nunavut. To ensure trick-or-treating and other Halloween events are done safely, the Department of Health, along with Community and Government Services, Sports and Recreation, have released a set of guidelines. These guidelines are available on the GN website and will be distributed to hamlets. Thank you.
Tana ko kaya naktumipid ako tigin niya ako tamak ko ano na bumimakutut ang malo matimin ni makutut kayo yaman niya nga tayo ano kalot si manakpik no na bumi kayo sigun na niya ako tako pula kakatakon na hulugit asingin nilo ano kalot si manaw kanilo ko tayo at tanak tumitay li hulugit ano ham nang itulirikot ang malo nunalin ni gavamakun nilo piyit sa artikot pingwa tuliriking ikipingwi ay yulirikingin bingani amalo tuni khataw na sa tiham lalimano o yan na may
Ken Driscoll, APTN National News. Dr. Patterson, you talked a little bit about the changes to the total amount of people allowed to gather. I know here in Iqaluit, while city facilities are able to be used for recreation now, like the rinks and the pool, the schools still aren't allowing private groups to use their facilities. So if you swim or play hockey, you can use the facilities, but if you play basketball or badminton or volleyball, you're still out of luck. I'm wondering, is the directive to not rent those out to community groups, is that from your office or is that a decision made by the individual DEAs?
Ken Driscoll, APTN Kunikluta Patterson o kakao gavita ko katilimak to gahat sigum nak ningi katikatagon nak to tamane kalon ni sidik ni tamak ko solo matuyo nga lekalo atilogi pingwa be tamak ko nikitok be pwedjok belo ilinner be sulita ko atok to atagon nang itita mata ta ko solo haki khatak to haki kum nakalo atilogi ramalo pwedjok nak to kisani tamak ko singi pingwa ko ti suli pingwa ko taw gun nangin mata ilit sini labingan ay tili yaw ko taw sa mabata ko atok taw at ako nagi ilin nerbe mi pingwa be.
As of Monday, it's no longer a directive coming from the Department of Health. Individual facilities and individual education authorities have to prepare their facilities for this and do their own risk assessment to make it work for local circumstances. So there will be some that have not yet ready to open. Hopefully they'll be able to do that in good time.
Monday mi pigan lugo taman na tilis digitu si mayan na ham nang ituliri kunni kuya na taw si manalak to kasi anita ko ato ni pingwa biyot ilid na tuliri na ilid na tuliri kunwa wala taw yut naminak matiron mamanga tanalo na sa kataron na nalak to kasi anita ko ajigi jang itu ilang ya ato ina jang matasuli matu chaw tigi jayut chaw ngito tamak ko ni malitaw gailin ni piyare kara hangata.
And then I'm wondering, what is your recommendation to those individual DEAs? I know you don't want to give a blanket one, but I'm wondering, what should they be looking for to include in their plan to reopen safely?
Nalia perilang medyo kano atuliga yang mga pitako atunin alin na atuliga ko katimaying ikisuni sumatsaksi ko tika gaya kamatu yak sinyaro ti kikulimano ta ko nga pingwabingin ni.
The big one is sticking to the limits in terms of number of participants and maintaining cleanliness, having hand sanitizer available and being able to properly clean the facilities after use.
Tana ang inakpango yukta ko katsi mga takatigon nakto malitaw sa law to akata amalo salumak siya taw lo salumak siya taw katakata amalo tay kuning agani hupit ko ya ko te ya to ni kay may to ni atu na khat sa lo te kam malo tok taw gito ay pata salom mataw sa khat to akata.
Emma Tranter, Canadian Press. You said that the outbreak at the mine is now contained. Can you explain to us what that means and how you know that it has been contained?
Emma Tranter, Canadian Press kumnekta ko kakkaw go bisag mapalya gum ni nga taw ya kam na bimme kanu kaw yi magabita ko sa mapalya jagum ni nga ta.
We believe we've identified all of the high-risk contacts, the people who are at the greatest risk of developing COVID-19 over the next little while. They're in isolation. The remainder of the staff are lower risk, so their chance of developing COVID-19 is less than 1% right now, and so that's considered safe for them to travel.
Sulayo sakto gutak ko nalo na taw si matsalari nga taw lo kaya naktuming nakpangulaw to katiyaw katak si mayut tay masa makpigum na nakpangul yu yalaw to no wadyo nak 19 mi inutuga hakti taw law nga talo takko alo asing ulo kaya naktuming ni say katiyaw si mangito tay ma 1% atani tay masa makpigya ngi sa malun nang mata tay may matay awla kun naksiki taw yu ulo kaya naktukong ilote.
An employee we spoke to at the mine said in their view this happened because people were not social distancing or following COVID-19 rules before this outbreak began. Did the rapid response team notice that maybe as a reason why this spread so quickly? Was there any evidence of that?
Kana yakti me hakatang nga taw yakam na bimme tama tuminga gumalit siya lang imatay no katigit umasige katara hamningin taman no wadyo na pidyo tigil lugo siya malaki na taw lawngat tay ko to agam naktuk kayo kaya to tamag tuminga kaw yilaw ka tay malit siya ngit tuminingin ni.
Yeah, that's been a common theme from in communication between staff on the ground, both general staff, medical staff, the rapid response team, and management. And the management has already committed to reviewing and revising their infection control measures and finding ways to ensure that those standards are maintained at all times to prevent this kind of an event or minimize the chance of it happening again and spreading as far as it did should it happen.
Tay may kayo katak do ta ko to sa bigis na malugi di kana yakti tay ko ngawlak ti tawlak to ana ham nang ituloy na mo tamaluta ko to abam nakti ko kayo yakti yut amalutay ko awlat si jingit himik put siya na am nakaktot akigar lugi lutaman na siya maktit si tayli nak mumalit taw galin nik tay mangalimar lumalit tawin na hatta lugi taman na siya mapalakan nilik nago.
Beth Brown, CBC. You have briefly mentioned this for Emma, but more simply, was the mine doing enough in your eyes to keep this sort of outbreak from happening?
Beth Brown, CBC, kumnikta ko yakam na ko kanwilip siya nakalawak kay bisu magiyang ago taman na siya mapalaya ko nago.
I think it's too soon to get into laying blame on any one organization or level. There's government responsibility, there's corporate responsibility, and there's also personal responsibility to to minimize the chance of an outbreak like this happening and spreading as far as it did. And we have to look at all of those levels in order to minimize the chance of recurrence.
Man nakila may ulo akto pasit siga so tukak na kat nalani tuinak tako ato ni piligat sa hakti yung mataga ba makut amalo namin ni hakti yut amalo inu intamako ato ni ilo na te piligat sa hakti na matataman na siya mapalale ko nagutay masayang malawman tako kingo ni ago kimikut siya ka hak na aktabo kanok nalo na aktaw kanak naksagun na lang mga.
Whose jurisdiction is it overall to manage an outbreak like this at a private or a business place? Does the government have the authority to step in under the Public Health Act, or at the end of the day, is it the mine's responsibility to have check more boxes? Whose jurisdiction is it?
Kikkusangin hartiu ko tamanna suullu sama palleani ulautu pidjutikillugu. Taako nammine hartiu yut balogava makkut. Taako anne hamnangittulerina mu pehujangatigu. Ujaramne artikku taako nam ila pileriat sa hartiu giba tamatuminga.
You mean in response to an outbreak?
Yeah, and just making sure that that doesn't happen.
Yeah. Well, making sure it doesn't happen is prevention, and that is under worker safety compensation, and we provide support in that, the Department of Health through the Office of Chief Public Health Officer. Response to an outbreak, though, once an outbreak has occurred, it is quite clear that the Public Health Act has paramountcy over all the other legal acts, and that means that the Office of the Chief Public Health Officer has authority over the response to an outbreak.
Taako pidjutikillugu kikku kamayuga yang mangata tamanna sibunga gunuk hangati tauga suarninga taako nu ekna yaktinu nalliukku maaliriyikunu anna tuliriyikkunullu kama la piliriat sarijaojo anna hamnangituliriyikkunnu ikayoktauluni taako nu ngalo anna hamnangituliriyimmario allabbingatigut taako kamayuga yaktu searmakto harnekhat tukisinat siya nga na hamnangitulirin mo pehuyang mitako sanginak pangugut sa harun ng ngata pehuyak tigut tatso maalabing na hamnangitulirin mario.
Dustin Patar, Nunavut News. So you kind of touched on this already, Dr. Patterson, but on Tuesday the country saw just over 2,300 cases, which was the single highest day increase since the beginning of the pandemic. Why change the territory's orders now?
Dustin Patar, Nunavut News, Gubnita, 2,300 ngunikaktaw lila ngata ulumi ataw sa mikanata mitako amisong ngaktaw yun. Amisong palia yualo to inautin lugis matako malitaw gali asidjitalakigin.
We still have the protective effect of the travel measures in place. We also have the benefit of the increased access to testing and improved turnaround time. And that gives us the benefit of taking measures to reduce some of the more harmful effects of the measures that were in place. And especially for the limitations on youth groups after school activities, that has a pretty significant impact. They had very little access to recreation outside of school, and now that things are better for the territory, we wanted to improve their access. Sorry, Uli.
Suli manau yung tako sapub miyaw siya ko tiginik pa kayabot tako tikit tailit itsikhatak ng mo tamalo inutu kay nakatara haktit sinang mo amalo tako akaw isa ko tiyo utisa kayo neksaw katalir ning inut tako maligtaw gali timang atutiha ila sangilo alaw tu tamat ko isulit takbi utitaw pilo akto may makkutuno sokusir nullo kasuyaw gyak si mamata tayo matuin na hangilo alay law kata tuin na utin ni tayo may mat tako matuin kan nirum naktipo valaya si mayabu.
There have been reports that Ottawa area hospitals, including the Children's Hospital, are close to capacity. What does that mean for medical travelers that are headed down south?
Tusang nasi mamaan arawami anerbialui tako alusukusang na anerbi tatapalalang ata hanong lataman natuin hanaka anerbila patono.
At this point, it hasn't changed anything as far as scheduled travel, because those don't necessarily have to go into the hospital or be admitted. And it has not impacted medevacs. We haven't had to divert anybody needing emergency travel. If that happens, then we may have to look at other hospitals, but at the same time, the Ottawa hospitals have committed to accepting most, if not all, of our patients as they have in the past.
Manayo taman na si Jesse Madjang ito tako piluak na may ulot ila akitaw si mayo init saliok taw si mayo tako unigiak to tsaw tigikaptari atong imata tuwi na kadyang ito alaman at tuwi na kadyang ito tuwang naktuk ko kang atayo ka ulak titaw galinik kasi ni tayo may nakapalagon ni tutsaw na katasingin na balon ni kawigi atwin na kakakayak tugo kasi ni manaw yung suli arwa ma ulak titaw katakon nakton.
Along the same lines, if the situation down south continues to deteriorate, is there a point where you try to keep medical travelers in Nunavut for procedures that we're equipped to deal with, like pregnancies?
Tako yang na bibidyo tigil lugi halo na nilo ami sungguak palya si maningi tako kano isulit tabikak palya tituin na kaya hakigian na bilyak titiyaw lahat na kaya li pimari yung ito no.
That very much depends on capacity to safely deliver here in territory or in the Northwest Territories, and so it's a balance of risks and benefits.
Taman na kisani isumagi kara yakta butsulo yung niga hakto katamani no na bumiyang nakatakaw na tunun at sa bilo. Kisani nalamugwitit siga hakatatako kano ulo kaya nagtumitay lugun na kayang mga tao la kaya tumiloti.
Ken Frisco, APTN National News. Back in the summer when you asked people to not leave for summer vacation, many ignored that advice. Now, I'm wondering, what steps are you taking to get ready for a spike in the isolation hubs in December when people ignore advice and decide to visit south over the holidays?
Kentus ko ipitian kunik au yakko hakata yuga bitako au lahatta ko yinati pimari yung ito ni pidjuti hangilutik tako nalat siyang itsimam mata misujut tako alo ami songo kaya tut sa mata pilo ak tumikika kaya kata di December minutu view kaya tako nung nalat siya sa mga ito no kano taman na kamag inakyo.
Well, I think the first off, the advice to not travel remains the same, and the support for it is going to increase as the cases of COVID-19 increase in other jurisdictions. Everyone who is traveling south or planning to travel south needs to understand that we are not considering increasing capacity for the isolation in the south at this point in time, and so there's a very real chance if a lot of people are traveling south that there may be a wait time to get into the hubs at the end of the Christmas holidays, and that may not be pleasant, but it's the reality of the situation.
Isumayong alita ko kau tiga ako tigi simaya butay matsay na maraw lalote lahat ako yung kalawat pidjuti hat sang ilutik pilo aktimita ko ami songo pala tilugi no badyo anak 19 liya singin ni kanlunani abito simavyo yuni tako pag nato hakaw lang na mga takanlunano tako pilo aktimi ko ba subyo na akto tako ami songo kaya aktaw jang ito tuyok bibi kanlunani inutuvyo kay na kaya tako aw lang na ako titay mautak higa hatuin na realit inikhakunit simatuin na kailangan tapilo aktimi ko ba subyo ulong inasimalakata tako ami songo kaya aktaw jang mata tuyok bibi inigijaw nakto.
And just to supplement Dr. Patterson's response a little bit, I have to really try and reinforce that essential travel is not recommended. But if you do have to leave, we were all missing our family, but if you do have to leave, I strongly recommend that when you know your travel schedule, that you contact the isolation request email so that you can register your schedule as soon as possible to alleviate the wait times as much as possible.
Ilagay ang lugulo ta Patterson kaya ko tigakaktak tanga tayo maukakan na rumagamata ko apim makayong ito may video tikarluti ang lateli kujigat ta suli kaya magalawak ito nga tayo mailamin ni ungalang nga ta tamakwelo at so naktuko nga tayo ilang ito na aulang na ito ako tayo matut sirat sa tigakakat ta kaya li tayo kanito yung may bininit sa liw sa tigis malutik tayo utak kigali amisulo ay nila ako nagyataw chiko.
Emma Trancher, the Canadian Press. With the 10 positive cases and there's 6 presumptive positives, would that mean if those come back positive, then one of our machines would be certified at that point? Where are we at in terms of certification?
Emma Trancher, Canadian Press, kunita ko ako nakalakaw gabigit lalo na ito si Mayut ang malo pingasuyok tuluti ko pasagiyaw yun. Tayo malita ko kaya sa ko titi tayo lalo na ito si Matsala kakanwing ito kaya nga tayo kaya sa ko tiyo si malagning ano.
Yeah, that's correct. It'll mean at least one machine is validated. Some of the remaining samples have been transferred to Iqaluit to be retested here as well, which will also increase the ability to validate at least one machine here. So but it's not a number we wanted to get to.
Tana tausi kawya sa kutiyo naluna tausi sumalak tu tamahatang ininganik takolo ilangit ikalun no aulak titaw ni angata kawya sa taulak hikan na reaktor ti tana naluna taw kan nila kayak meyo kanu ingit tu ganganik tay makatsiw ning itikiuti ko malawng itakalo abo kisa ni itikiuti si mayalo gilakatigo.
So just to clarify, that would be the machine in Rankin Inlet, and if so, what does that mean then for testing turnaround time in the territory?
Tay na kawya sa kutiyo kanya sinak me kanu igun niraktayo balu tamakoti sa kay katang ning naluna sigutiyo kanyang nalakat.
It's not going to change the turnaround time for when we announce presumptive. We can say confirmed once we hit 15. We can say that the COVID-19 is confirmed, and we could, in theory, use that device as the backup for the other devices in territory. So it changes things a little bit that way, but we would still continue to respond to presumptive positives the same as the confirmatory or confirmed positives.
Tana asidjid jang itu galwa kanu tigi khilami unasakko ti khatam na mangata kisa ni pasagi jaw yu nakaktaw nakay kun nakalawak tigut tako 15 ko katano ba jo anak 19 nalu na taw si maningitana nalu na taw kan na sinangat dan nakawi sa kutiyo atok taw kan ila atok taw kun naksiluni nalu na sigutiyo hatang luni ana asidjid ko taw jang itu tako pasagi jaw nakaktaw yu ambalo nalu na taw nakaktaw yu nalu na taw hatang ningin ni tay machay na lang ayok suli.
One thing, Beth, just to add, that's confirmatory only for COVID-19. The BioFire tests for more than a dozen other pathogens, and all of those results, like pertussis and other viruses, would still be needing the minimum number to be able to say that they're confirmatory.
Ilagay kan naluguta ko nalu na taw nakaktaw kataw naknakto nuwa jam 19 kam nakaktaw unique. Dan nakawis ako tiyo BioFire ngun nakaktaw yok asingin ni taw kawis ako tiyo kun nangatako sulo khuyaksu naw unique asingin nilo sa makung naktunik tako nalu na taw ko tiyo kun nanaksaw kataw nalakto.
Beth Brown, CBC. Once you have those machines validated, will you continue to send the tests to labs in the south?
Beth Brown, CBC, kunita ko nalu na taw sa malakata kanwing itugang kawis ako tiyo yusuli kalunano awlaktot sa katalakisi.
We will continue, certainly as part of the confirmation for all the other parts of the panel.
Parts of the what?
The panel, the group of tests that the machine, the BioFire does, we have to continue for those results.
Suli awlak taw kataga ham na taw nalu na taw ga kannerlo te kalunani ta na pilo akto mi BioFire mi kawis ako tiyo.
But once it's confirmed and the machine's fully validated, then we can issue confirmatory results from that BioFire instrument right away.
Kasi nalo na sinigay katakot ng naktigotat ko nalo na sinigay lutatat sa mga BioFire mo kawis ako timinyo yun.
With the cases at the mine, where does this bring us as far as account for Nunavut? Are we still at zero, like when we saw the other mines, or do we have a number of cases here now recorded?
Tako ya na biminalo na taw sa malaktilugay tako nasak taw sa mayot sulino na bumi pitakangin nakaktaw ba o balo katsiulak katako nalo na taw sa manakaktaw yun na bumi siya maksimaningin.
It gets back to those rules of data reporting and attribution that we talked about before. When the confirmed results come back positive, the territorial epidemiology team contacts the home jurisdiction and negotiates on who's going to report it. And so far in those cases that the negotiations have concluded, the home jurisdictions have elected to report it from their jurisdiction, their province or territory.
Taman na utabi nakatigo tako na minasak taw katang na mga taw kausiriyo jabut nalo na taw si malakalo at tilugi tayo mano ba dyan naktukak ningin ni tako sir maktuligit tako ayi katikakpat to tako namimiw taw vingin nik kikunulo nasak taw na mga ta Teme takwa aye ko tawag sa malangata tay ko angik si mayo takwa angik kayang itanun ang ninasak taw sa mga nakto Nunavut ito.
Can you speak to your announcement about Halloween? Why is it that children will be able to go door to door, home to home right now?
Ukaw sa kong nakyo tayo maano kalos si manaw na aktilugo sumatay mapula ka kong naktit silang ang mga akpin.
Because there's no COVID in territory and because there will be recommendations and guidelines to reduce the risk of Halloween, the usual activities, spreading any viral disease.
Upin na kanita mani no badyo anak 19 hangin manuna bumisuli ang malo atuli ko jaw si mayo ni malitaw galin nilo nalo na si magatta malitaw galin ni taman na sa mapaliat ko nagukhano tuin na kisutuin na isa magunak to.
Dustin Petard, Nunavut News. This question is for Minister Hickes. So, as you said, the holidays are coming up, and it sounds like you're already taking reservations for the isolation hubs for January. How many people have already requested slots, do you know, for January?
Dustin Petard, Nunavut News, Minister Hickes. Ukakagawit amak ko akikak na ulalang ni ngani init saliyok to kakatarir si malika maluhat si ulik katako init saliyok si mayo.
Thanks for the question. I don't have that level of detail. I will put a asterisk, I guess, around my earlier comment that one thing we can't control is the medical traveler demand. So if you may have a reservation established for a certain period of time and put your request in well in advance, but it still may not be able to be accommodated through the medical travel portion as well. So everyone needs to keep aware. Again, the non-essential travel is highly discouraged. Thank you.
Hujan na may tako ilulingin ni hao yung mga itong kisanin na luna sisigakan na umayong atako sivula pa utitaw katang na ngataan na bilyar luti aw lakayali tako alaw lak na akto init sa liw sa utigis si makatako gatigo sibong agot kisanin hao yung magyalian na bilyar to na sivuli utit si katalang katam malupin makayong ito na pidyo tili aw lakayali aw latay hujan alaw abusuli.
So waiting in line is a regular occurrence here in Iqaluit, but as we head into winter and the temperatures drop, that'll become increasingly difficult. Does the Department of Finance have any measures in place to mitigate the line at the beer and wine store here in town?
Tako ang ilay kalon ni mautak sitialo ulit at alay na pakatak so ta ikinak si Valyanin alak tilugo kina yaliridik ko isa mas lumapatay ka ni beer and wine tabi me hanok tako kilami yung nasako.
Thanks for the question. And there has been some early discussions on what we can do to mitigate, looking at increase in hours or things along those lines. There's a certain capacity for room to put in any more stations is obviously restricted by the space and the safe working environment for our staff, but we are considering a couple of options. Thanks.
Hujan na may taman no how si Valyas mayo galoa kano kao si balak titawag ng mga solo ikakangit ako niyo kanak titawag ti matoy nga hatang ningit tanalo inihangilo ang iligyak tawag na kanilo kisani at tanak tumitay litiga kami gatigo kanayak tibo kisani asingin ni nalira ako titsani isuma si mayo.
I'm a Trencher Canadian Press. Dr. Patterson, please. Now that we've had cases at 3 mines in the territory, and last week you ordered that essential workers need to wear masks when entering the territory, do you have it in your jurisdiction to put any regulations or, I guess, restrictions on miners entering the territory?
I'm a Trencher Canadian Press kunik. Tako nalo na tao si mayo halang pinga suni uyang na binni. Amalutak ko ibi mariyunit kanayali tiki hatak tu matuak si may nakakalik tilugit asingin ni sangini kakote kakita makunungaw yakam ni aktino.
Yeah, we do, and it's we've been working with the mines and the chamber that represents the mines across the territory since there's been ongoing communications for a while, but there's been a number of meetings since I think either late August or early September in trying to work out ways to reduce the risk of introduction of COVID-19 to mines and to, by doing that, to allow Nunavut to return to work at the mines.
Sangin hakute haktegut takwa pilari khate gunnak simayabu uyagar nerbi amalo uyagar nerbi katut khatigi ngitamakuna ni abitos simabiu yuni tusama khatigi khatar suta katema khatar sutalo August nungwani amalo September pigar ningani taman siar mapalle gunnak se ngit sa atigunu badjo na takuna ni uyagar nerbi mi amalo Nunavut Iqana yakan ne gunnak sigun nakhullugi takwa pilari khatigi balle ayabu.
Beth Brown, CBC. Understanding that there are outbreaks in the south right now, is there any talk of expanding Nunavut's travel bubble to provinces or regions or territories that aren't seeing high numbers of COVID?
Beth Brown, CBC kunni. Tako sama pala matamiso kallunani amalu tamakwa awla hatabegun naktu ang ikatigi gutiu bala simayo kakasingin ni kallunani balokyo taktumya bitok simabiyo yun.
There's been nothing new since the last update. There's been some discussion between Northwest Territories and some of the Atlantic bubbles, or some contact about having a bubble involving us with the Atlantic bubble, but nothing's definitive on that. And with the increasing cases in Quebec, there's no consideration right now of a bubble with Nunavut.
Mana nutani ukaw sit sa kangit tugut ukaw tigi hatas mayo galo atako alo nunat siya meon solo kanataw kanan nanganut awlak be khatar awlak tigi gunna khatar na mga taw khatigi pala balayo galo at kisa ni ufagullo kanataw lo kanan na meutangin not suli ang ako tahak sumangit tugut pilo akto miluta ko ami song pala sa mamata Quebec mi manaw yo awlak tigi khatar na jangit tugun nunavik meutang no.